Hello. Today I'm going to discuss anaphylaxis. Just a quick summary of what it is, how it's diagnosed, a bit about the pathophysiology behind it, and we'll also talk about the treatment as well. So what is anaphylaxis? Anaphylaxis is a severe allergic reaction of rapid onset. It's an example of a type 1 hypersensitivity reaction, and typical triggers include latex, insect stings, certain foods, and also some medications. It's caused by the release of inflammatory mediators, mainly from mast cells. Also there's some involvement from basophils as well, although to a lesser extent. And this is usually in response to an immunologic process. So a bit more about the pathophysiology behind anaphylaxis. So when a susceptible person first comes into contact with the allergen, plasma cells will produce IgE antibodies against the particular antigen. These IgEs will then bind to Fc receptors on mast cells and basophils. Then, at some point in the future, on further exposure to the allergen, the antigens will bind to these IgEs bound to the mast cells or basophils, resulting in mast cell degranulation and the release of inflammatory mediators such as histamine, nitric oxide, and tryptase, as well as others. So the result of this release is systemic vasodilation of blood vessels, contraction of bronchial smooth muscles. There's increased vascular permeability, so more fluid moves from the blood vessels out into the interstitial space and into tissues. And there's also a depression of the heart muscle, which leads to hypotension, and the constriction of the bronchosmooth muscles leads to difficulty breathing. The autonomic nervous system is also activated. This increases the heart rate, results in anxiety. The patient often has a feeling of kind of impending doom, and there's an over-secretion of mucus, which again makes it more difficult for the patient to breathe. So on to diagnosis. Anaphylaxis is diagnosed based on the clinical presentation of the patient. So anaphylaxis will result in rapid onset of breathlessness, wheeze, often have a rash, the low blood pressure, anxiety, and also nausea and vomiting, as well as many other signs and symptoms. It's a very wide disorder, can lead to many problems. So kind of laboratory testing wise, you'd normally take a serum tryptase, although you wouldn't delay your treatment when waiting for the result. And if the patient has signs and symptoms suggestive of anaphylaxis, and you would go ahead and treat them instantly, because it can take a few hours for the serum tryptase result to return, and the serum tryptase levels would be increased in anaphylaxis. So after treating the acute episode of anaphylaxis, you would also want the patient to undergo allergen testing to find out what the allergen was that caused this episode of anaphylaxis. So on to treatment. So after identifying the patient is in anaphylaxis, you would put the patient onto their back and raise their legs up into the air. And what this does is increases venous return back to the heart, which increases the preload and also increases the cardiac output of the heart. You'd also give all patients oxygen, and then intramuscular adrenaline. So intramuscular adrenaline has many effects that help in the treatment of anaphylaxis. such as vasoconstriction. It also increases the contraction of the heart muscle and increases the heart rate. It relaxes bronchial smooth muscle and also decreases the continued release of inflammatory mediators. As the patient has possibly lost quite a lot of fluid out from the intravascular system, you'd also give the person IV fluids such as saline to try and correct the volume redistribution that's happened. So again, after the acute episode, you would try and identify the allergen causing it, and if you do identify it, then you'd tell the patient to try and avoid the allergen if possible, and you'd also give them an adrenaline auto-injector to carry with them in case they have another attack. So anaphylaxis can be fatal, although prognosis is very good if they receive prompt medical treatment. And those who've had a previous episode are at an increased risk of having another one. Okay, so that was a quick summary of anaphylaxis. If you have any questions or comments, then feel free to leave them below. And I'll put some links in the descriptions where I got this information from. Thanks.